Good evening, everyone. Welcome to my EdTalk. Today I will be discussing factor Xa inhibitors. Some examples of factor Xa inhibitors are rivaroxaban or Xarelto and apixaban or Eliquis. The indications for these medications are DVT, PE, or AFib prophylaxis. The way that these medications work is they're going to directly inhibit the factor Xa, stopping activation of all coagulation factors in the final common pathway. So it's going to stop activation right here, and that'll prevent all of these activations from happening. All right, so some adverse effects, bleeding and hemorrhage. So I'm sure we've all seen in our trauma patients, our ground level fall little lady falling and having like a head bleed or a hemorrhage. They should probably get life alert. Some contraindications for factor Xa inhibitors are AFib with a creatinine clearance of less than 95 mLs per minute. And there is no lab monitoring required for these patients. A couple interesting things here. So the reversal is going to be DEXA or andexaton alpha. It's a factor Xa decoy competing with factor Xa to bind with these drugs. But the problem with this medication is it is very expensive. It is just under $25,000 for a dose. And as of, I believe, 2018 or 2019, this medication was not readily available in emergency rooms to help with patients, and plus the cost. But I believe after 2018, that has changed. However, the cost has not. So something to consider when having a loved one having to get on a medication like Eliquis or Xarelto. Some things that are pertinent to us in anesthesia are going to be how long these patients need to hold these medications pre-op and when can they be resumed. So apixaban, this is going to be based on the creatinine level. So if it is less than or equal to 1.5, then they can hold for 1 day. However, if it's greater than 1.5, they need to hold for 2 days. If this is like a high-risk bleeding type surgery, they need to hold 2 to 3 days. Whereas rivaroxaban is going to be based on the creatinine clearance. So greater than 50, 1 day, less than 50 is going to be 2 days, but also high risk operations are going to be 2 to 3 days. And for both of these medications, the patient is able to resume their factor Xa inhibitors within 24 hours or after 24 hours. However, if this surgery was high risk for bleeding, then they want to hold it for 48 to 72 hours. All right, I hope this was helpful. Thank you.